A very good evening to you, our esteemed viewers. We are glad each time we know that you are out there on your phones, on your TVs, watching Church of Uganda Family TV. You impress us, and you're the reason we come back every now and then to give you the very best of fully packed programs like Health Port. Health Port is a health program brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. EDRINE MUKALAZI is my name. As we've always promised you, when we promise, we fulfill. The whole of this month, we are looking at asthma as a disease, and we are proudly joined by Makerere University Lung Institute. So they're taking us through the episodes on asthma. Like last week, we had Dr. Rebecca Nantanda take us through the various ways in which asthma presents. The things that you can look at as a parent to know that my child might be having asthma. And today, we are still with Dr. Rebecca Nantanda. Doctor, we are delighted that you are back once again to share with us. Thank you so much for always sparing this time to come and talk to our viewers.
Thank you, EDRINE, and good evening, our viewers.
Well, when we look at our set here, we have things that don't look ordinary to some of us. So people might be asking, what are those? What do they have for us today? Well, we are going to look at the treatment of asthma, how asthma is treated, because this is another disturbing way. This is another disturbing thing in our parents out there. So, Doctor, last week we were looking at the various ways through which asthma presents, and today I want us to look at how asthma is treated. I have my child, I've seen all the symptoms, and I've brought this child to you, the pediatricians. What do you do with my child?
Okay, thank you, EDRINE. So, like we mentioned last time, that asthma may present when a child is brought to us when they're having an asthma attack.
Yes. Meaning
that the tubes that take oxygen, air in and out of the lungs have become very narrow, and that's why they can't breathe. So we give you medicine which we call reliever. It is an English word which means that they are going to relieve that narrowing or the obstruction. If a child comes in with the symptoms they're not in an attack, but they have symptoms which we have gone through with you, you've told us the story of the child, we've done some tests, and we think that child has asthma, then there is medicine which we give you, which we call controllers. Sometimes we call them preventers. But in simple terms, it basically means, like I explained, that people who have asthma, it means that the inside of those tubes overreacts. And when it overreacts, it becomes irritable, or in science what we call inflammation. So the medicine which we call controllers, it's to control the inflammation. And because the inflammation is controlled, then that child will not be having frequent attacks. So in other ways, we can also call it a preventer, because it prevents the attacks. Yes, so there are two types. The reliever, when you have an attack, so that that obstruction or that narrowing is relieved and you can breathe better. But that is not enough. We also need to give you what we call the controller or preventer, the one that controls that irritability or inflammation, but also prevents attacks. So
if I may say, when I come with a child who has an attack, you give them both relievers and controllers.
Exactly.
But a child who doesn't have any attack, but they have symptoms, you just give them controllers.
We still give you both. So when you come when you have an attack, we give you both medicines to use there and then and to continue using. When you come in when you don't have an attack, we still give you both, so that in the event that you get an attack, then you have your reliever ready to use. It's kind of first aid for somebody who has asthma, so that they can get relief. And it's also very important that we have both medicines all the time, especially the one which relieves, so that when you get an attack, you don't wait hours and hours before it gets attended to, because the narrowing increases. And like I mentioned last time, every time we have an attack, every time those lungs inflamed or they are narrowing, it actually damages your lungs. So we want to act quickly when that attack comes.
Yes. So you've given me, is it me to administer them to the child, or it is you, the medical personnel?
Okay. When you come in an attack, we'll treat you, our nurses or the doctor, whoever is around. First of all, we shall examine the child and find out, is it something that is mild? Because we have some attacks that are mild. Some attacks are so bad, and we can actually, in simple terms, we call them they're life-threatening. So we do different things depending on what we have assessed. So when you're in hospital, we give you the medicine. But when we are discharging you to go, we must teach you how to use those medicines. Because the medicine we use are not like the common medicines, which are tablets or syrups or capsules. They are inhalers. So we have to train you how to use the inhalers. It is very important that you use them properly so that the medicine goes in the lungs where the problem is.
Does it mean that both the relievers and the controllers are inhalers?
Exactly.
How do I draw a difference then? If you've given me both, you've given me a reliever and a controller, how do I differentiate it? Now, this is a reliever or this is a controller?
We teach you. So when you come to us, it's not like, how are you today? This is your medicine, go. The most important part, besides knowing that you have asthma and talking to you about the disease, we also go through a whole session of teaching you how to use the inhalers. So because there are usually two types, it's easy. We can say, sometimes we can use colors and we say, this one is the one which you should take every day. This one is the one which you should use when you have an attack. Of course, we do this every time you come for the visit, because sometimes the first visit can be overwhelming for the parent. They have got the diagnosis, we are telling them about inhalers, they're going to use them for the first time. We are teaching them techniques of making sure that the medicine reaches the lungs. So in a few cases, when the parents reach home, or if they're older children, when they reach home, they could exchange. And instead of, because one of them you're supposed to use every day, another one you only use when you're having an attack. So sometimes they interchange them, and then the one which is supposed to be used every day is kept for the attack, and then the one which is for the attack is used every day. So usually when we see you, we give you an appointment, in most cases within 1 or 2 weeks, and we ask you to come with all the medication so that we go through a session again. Show us how you use the medicine, which one did you use when, and then we can fill in the gaps if there are any.
Okay. What happens if I use a reliever instead of a controller? Do I get the same result?
No, you don't. Because a reliever, like I explained, it's only if the tubes are narrow. You give that medicine, it makes the tubes wider. That is its sole purpose, to help you breathe better. But it will not control the irritability that I talked about. So you'll be using it, but it's not doing anything. And like any medication, there may be side effects. Overuse of a medicine, even food is medicine, but if you overeat, you get problems. So it's not good to be using the one which is supposed to be for reliever as a controller. The same thing happens for the controllers. Their medicines we use every day, so that it's a gradual process of controlling that irritability. So if you only use it when you have an attack, it means you're not going to achieve what we want of controlling the symptoms and preventing the attacks, because you're using it wrongly. So we always ask of any parent who is out there who has been prescribed the inhalers, whenever you go to see your doctor, make sure you go with the medicines and we show them, this is what I use, this is what I use. If there are any problems, they'll be able to correct you so that you get the maximum benefit out of the treatment. Another
situation is here. Maybe I have asthma and I have my reliever and controller. Jonah, my producer, has asthma too. I find him with an attack and I have my reliever on me. Can I use my reliever to help him, or it is from me and only me alone?
Okay, so it's good you've asked that question, and it happens many times, especially in adolescents. I forgot my medicine. So the relievers and the controllers, the medicine in those inhalers, which look like this, not these colors, but inhalers look like this. They can be different colors depending on the type of medicine in there. There are only two, scientifically there are two types. The controller has a particular medicine and the reliever. So you can actually use your colleague's inhaler, which is a reliever, to relieve yourself.
Okay.
But these are the days where we are cautious about sharing things, especially the ones that are going to be used in the mouth. So we emphasize that please make sure you have your inhaler all the time and check to make sure that there is still medicine. Because sometimes it is done and you don't know, and you're shaking and you're pumping, nothing is coming out, nothing is coming out. So it's important to have it all the time, but also to make sure.
Is the medicine inside there powdered or liquid?
It's like, we call them aerosols. It's not powder. It's like, you could probably say it's a liquid. So when you puff it, like this one is finished. So if this was your inhaler, it wouldn't really be good. This one is still okay. So it comes out like that. Okay. And please keep it away from the children so they don't use it as perfume. Yes. So it's important to have your inhaler. But in the event that you don't have it and your colleague is not, it has the inhaler, you can use.
Oh,
okay, it will do the same job.
We really want to offer help to. Yeah. Now, doctor, when my child has an attack, yes, and I cannot access the hospital in time, is there anything like first aid I can administer onto this child before maybe I'm living deep in the village, the hospital is 15 kilometers away, and my child has an attack, I cannot even have a boda to bring me, trade me to the hospital. Exactly. Yes. What can I do in such a situation?
So whenever we see a child who has asthma, we give you that first aid and teach you, number one, how to recognize that an attack has started, and therefore you give the child the medicine. Now for children, remember we want the medicine in the lungs. You might have seen many times in the movies people putting this in the mouth and spraying.
Yes.
If you do that in real life when you're treating asthma, especially for a child, you'll be spraying in the mouth. And that medicine will not reach the lungs. And so you'll say, the inhaler has not worked.
Not only in movies, yes. I've also seen very many parents doing that. A child has an attack and they force the mouth to open and then they...
Yes, that medicine ends in the mouth. So it is important that the medicine goes right into the lungs because that's where the problem is. That is where the obstruction is, which we want to relieve.
Okay.
And in the right dose. So for children, we use what we call spacers. And spacer is basically just a chamber where we teach you when you come to us to fix the inhaler. So these days we are so used things around masks. So this side for the little children. So you put this on the nose.
Because the also looks like a mask.
Yes. So you put this to cover both the mouth and the nose. And when you put your inhaler here, it goes into this chamber. You cannot see the medicine. So don't say, but I cannot see the medicine, like you say a syrup. It is in there. So when you put this on the child's nose and mouth and you tell them to breathe in gently but deeply, every time they take a breath, the medicine goes along with the breath into the lungs. So these are the techniques I was talking about that we have to teach you.
Okay.
And it reach there in the right doses, and after a short time you'll see that it is ready. The child is relieved. Yes.
Well, doctor, let us shortly go for a commercial break, and then when we come back, we are still continuing with the treatment of asthma. Please keep your eyes on Family TV. This is Health Pod, and we are glad that your eyes are still on Church Uganda Family TV and you're still watching Health Pod. We are glad that you, together with your family, you've really sat down to watch Church Uganda Family TV. Yeah, and this is, we are looking at asthma and how asthma can be treated. We are with Dr. Rebecca Nantanda from Makerere University Lung Institute, taking us through the various ways how you can help your child who has an attack. Doctor, before going for the commercial break, you had actually demonstrated how we use this. Yes. But I'm looking at this is for young children, like you had told us. What about someone who has grown a little? Do they still need this?
Yes, they can use this. This is kind of universal. Even some adults will use the same thing.
Hey, but I see the...
Yeah,
you get a bigger mask.
Yeah, you can get a bigger one. This one can be detached.
Oh, okay.
You get a bigger one that will fit properly.
Okay.
There are some that are already designed for children, so you'll not detach. But for older children and even adults, We can train you how to use the sister of this.
Yeah, this is a sister.
Yes. So this one, instead of covering the entire mouth and nose, we ask you to put this end into your mouth. Okay? This is what you put in your mouth. You have the inhaler this side, and then you spray, and then you breathe in through the mouth. Breathe in through the mouth and out into the nose. So this also helps the medicine to reach the lungs.
Okay.
These are scientifically designed, but if you cannot afford this, because it may be costly for this people.
Yes, I look at my rural mother who cannot afford this, and yet they want their child to live.
So these mineral water bottles, you buy your water 1,000, you drink and throw away. If you have a child who has asthma, it can also actually help you. Yes.
How? Doctor,
so
please show us.
What we do, we teach you how to cut a hole at the bottom. And
locally?
Yes. You just get a knife, put it in the fire, and cut a hole at the bottom, which is in the shape of this end of the inhaler. And when somebody has an attack, or if you're taking your daily medication, you get your inhaler, fix it through this hole which you have created. Now this side is what you put in the mouth, you spray and take in and out.
Okay.
So if you cannot afford this, this can also help. Of course, this is superior because this one, after some time, the inside is not designed to keep the medicine in the air. So after some time, the medicine sticks onto the side, and you start getting a smaller dose. So when you come to us, we can also teach you how to frequently dispose this and get a new one. So if you cannot afford the spacer that is scientifically designed, please use this. We can teach you when you come to us instead of spraying the mouth. Yes.
So are these spacers found anywhere in pharmacies, or they are only supposed to be got from hospitals after diagnosis?
We have them in hospitals, we have them at the Lung Institute, but also in pharmacies they have them. So in the event that you've gone to a hospital where they have not given you an inhaler, rather a spacer, or they don't have them, we can send you buy it from a pharmacy. It is important that you come back to us and we teach you. It seems simple when I'm doing it here, but sometimes it can be the difference between getting better and not getting better, because this medicine must reach the lungs.
Okay.
Yes.
Doctor, someone in the previous episode said, please, we need a lot of information from you people of Lung Institute about asthma, because many of us have been misled. I personally lost a child in the hands of herbalists who had convinced me that they cure asthma.
First of all, I'm sorry to hear that. It's an unfortunate event, and thank you to Family TV and HealthPort, but also to our listeners for really coming to listen to this message about asthma. I want to emphasize the fact that asthma is treatable. We can treat asthma in children in all age groups. But the first step is actually getting the correct diagnosis. But as opposed to other medicines or other diseases like malaria, where they'll tell you, go and buy Coartem and swallow. As you have seen, there are things that need to be taught to you or the child, so that that medicine we are giving you reaches the lungs. At the Lung Institute, our clinics are open from Monday to Friday except on public holidays. It's a walk-in clinic. We pay a modest consultation fee, but what I want to emphasize is that when you go through this process of getting the right diagnosis, getting the right treatment, you save a lot of money in the future, because then you'll not be running to the hospital all the time spending no less than 200,000 shillings. And yet, this inhaler, for example, can go on for a month, 1.5 months, and it could cost anywhere between 50 and 80,000. That is much cheaper than the amount of money you'll spend on one admission, or even one visit, even if you're not admitted. And at the same time, we have controlled the symptoms, so your child is living a quality life. We have also prevented attacks, so we have prevented lung damage. So there is a lot to gain if you go to the right people, you get the diagnosis, you get the treatment, and then your child will be well.
Okay. Here is another question for you. Could there be an effective alternative to using inhaled corticosteroids?
Okay, so the medicine we usually have here is called the inhaled corticosteroids. It is like the standard medicine. It is the one which best controls that inflammation or that irritability. But occasionally, we may actually give children tablets. But it's after assessing that child, we try to do what we call individualized medicine. We don't treat as a group. So depending on what the child is presenting with, sometimes we may go to the tablets because they're easier to get, because this is not going to be possible, either affordability or just learning the technique until we reach a level where we are sure that you use this effectively. So we assess each parent and their child individually. So sometimes you can actually give tablets, but the preference is this one. And the reason is that it's in tiny doses. It is in micrograms, not milligrams. It goes right into the lungs. It acts more instantly because it's right there. And so other body parts are not affected. You know that when you're taking a tablet, it could cause side effects in other body parts while it is helping you. For this one, that is an added advantage. Yes.
Well, Doctor, you've talked about all this, and last week, as we are looking at the ways through which asthma presents, I asked you whether we can heal, we can cure asthma with all this medicine, or when I start, or when I'm introduced onto this medicine, it is now part of me. It is a lifelong thing that I will do forever and ever until death.
The answer is no. You don't have to be on asthma medicines for the rest of your life. So when we are treating somebody who has asthma, our goal as health workers is that we take away the symptoms that have been disturbing you. We prevent the attacks, so you don't have to keep in hospital. If you're a child, you keep in school. If you're a parent, you're able to go to work without worrying that they will call me anytime. And so you live a good quality life, you realize your dreams and all those kind of things. But remember, we said that something in your blood, in your genes, interacts with the things in the environment. And that's when you start getting those symptoms of cough and the rest. So we are not able to take away the gene, but we are able to control the irritability. So when you talk about cure, probably I would say no, but it also depends on what the parent you want. I'll not take away the gene, but am I able to make your child live a normal life, like other children? Participate in the sports, win medals, do for you housework, stay in school without coming home, have missed classes and all that. So we'll not take away the gene, but we are able to control the symptoms. And once we have controlled the symptoms, we reach a point where we take away the inhaler and we continue observing you, because at some point that over irritability, or sometimes they call it the anger within your tubes, can be controlled and you are okay even without medication. But I want to emphasize that it is a journey. It is not 1 week, it is not 2 weeks. For most of the diseases, at least in children that we know, like malaria, like diarrhea, they give you medicine within 3 days, your child is up and about. This one requires patience, requires sticking to the program that we create, taking medicines every day, coming for reviews, clinic days. Sometimes we change the doses because children keep growing and we need to change the dose. So it is important that we use the medicine as prescribed. We come to the clinic reviews as recommended. And at some point you get a point where you don't have any symptoms. And then we'll say, okay, you've been 6 months, you've been okay. Let's see, we reduce the dose and you're still okay. Then we say, okay, let's take away the medicine and you're still okay. So we say, your symptoms are controlled. So that is the language we shall use.
Okay.
Yes.
So if I don't have any symptoms, but I really want to be sure whether I'm free from asthma, I don't even have the other gene, are there tests you can take from me and then just to be sure?
So there are tests that we do. And those tests, remember I said the asthma is within those small tubes.
Yes.
So the tests that we do are the ones that measure the amount of air that is going in and out through those tubes. So if the amount of air is less than what we expect, given your age, whether you're male or female, whether you're black or white, or given your weight, because it varies according to those things. If it is less, it means that those tubes are narrow, and so you have asthma. Remember I said they can be narrow even without an attack, without you knowing. So when you've taken your medicine, we do that test again and we see that, the amount of air going through is normal amount. So we can say your symptoms are controlled, your lungs are functioning well, you can play the 90 minutes and even add for soccer and everything. But remember, there is the gene, so we tell you need to keep an eye. Should those symptoms recur, please come back and we see what to do.
Okay.
Yes.
Wow, thank you so much, Dr. Nantanda. We are indeed blessed, and we are still continuing with these episodes on asthma. And I think, Doctor, next time think about talking about the prevention, what people can do to prevent themselves from these signs, the triggers and all that. Yeah, that's what we shall look at next. And I just thank you so much for watching Church of Uganda Family TV. Thank you so much for following these episodes. Just in case you missed any of these episodes, just go to our YouTube channel, that is COU Family TV. You will find every episode there in the playlist of HealthPort. All these episodes are there, and I believe you'll be blessed. You'll be educated as well. EDRINE MUKALAZI is my name. This is HealthPort, brought to you by Makerere University School of Public Health. And then we are with Makerere University Lung Institute. But of course, I've worked with Jonah Jal, the producer, and Bantam in transmission. God bless you until we meet again next time.